Stubborn or recurring UTIs in women and some men is not a common scenario. But when it does happen, the usual course is often frequent courses of antibiotics or maybe even antibiotics in perpetuity by well-meaning physicians. But what if your chronic case of UTI wasn't UTI at all? Dr. Yuval Bibi, dermatologist, mission break you out of the UTI prison and possibly land you in the promised land of a symptom-free life. So first, the diagnosis of UTI often begins with the patient noting symptoms like burning or pain when urinating, otherwise known as dysuria. And then there's the urgency to urinate, meaning the sense that you need to urinate right here and now and can't really help it. In certain cases, the physician will follow with a urinalysis, which is often done by dipping a stick into a cup filled with urine, which can show factors that are consistent with a urinary tract infection. And there may be even a follow-up with bacterial culture of the urine to isolate the causing organism. The trouble is with recurring UTIs, some physicians may rely on symptoms only and may not perform the urinalysis that we talked about, or in certain cases when the urinalysis fails to show signs that are consistent with urinary tract infection, they may still label your case as urinary tract infection, treat you with antibiotics, and call it a day. If this is where you are and your UTIs keep recurring, understand that the symptoms of dysuria, meaning the burning and the pain when urinating, or the urgency that you may be sensing, are not specific to UTIs. Those are signs that are born from the irritation of the external meatus, meaning the outside or external opening of the urethra. And it can be the result of many different conditions. The most common conditions are vulvitis or irritation of the vulva. Those can happen for a variety of reasons. Zuhn's vulvitis, seborrheic dermatitis, psoriasis, irritant vulvitis due to friction or bad skincare, allergic contact vulvitis due to bad skincare. And then there are infections that are not UTIs, such as candidiasis or yeast infection, herpes simplex virus infections that can occur around the urethra, causing the same symptoms, and genital warts, again, that can spring up right around the urethral opening, causing the same symptoms as recurrent UTIs. And then there are the growths that can appear around the urethral opening, vascular lesions, as well as in more rare cases, vulvar or urethral cancer. In any case, if your UTI won't go away after a few courses of antibiotics, have your physician take a look at the area and determine if there is a problem that's visually diagnosable that could explain the symptoms you're experiencing. Most of the problems that I've listed can be diagnosed through simple physical examination. If your doctor's not a dermatologist, go see one. This may be one of the most important visits of your life that could transform you from a woman who is chronically suffering from UTIs to a woman who's had her issues resolved with a fairly simple way of managing any one of the syndromes and conditions that I've mentioned earlier. Make sure that your diagnosis of a UTI is backed by urinalysis and often bacterial culture to help manage your UTI in the best way possible. If you have recurring UTIs and your dermatologist was not able to pick up on the problem, go see a urologist to see if there's an upstream problem from what it is that you're facing. A urologist may investigate problems in the urinary tract upwards from the vulva and the vagina and find solutions to problems that occur inside the body. Make your chronic UTI a thing of the past by properly investigating the issue with the help of the experts, dermatologists and urologists, and treating the underlying issue. Let me know in the comment section how this video helped you manage your chronic UTI symptoms. Also, don't forget to share, like, and subscribe for more no BS skincare and medical perspective. See you next time. God bless.